Did you know that 1/3 of workers in our area go to work with the flu, according to a recent South Nassau Truth in Medicine poll? Do yourself and others a favor. Rest and stay home if you have the flu.
Hi, I'm Dr. Aaron Glatt. I'm the chairman of medicine at South Nassau Community's Hospital. I'm an infectious diseases physician. I'm also the hospital epidemiologist. And I'm here to talk to you today in our series on flu about what to do if you in fact do get the flu. So we spoke a little bit last time about the importance of staying away from other people if you have the flu. Stay home, don't go to work, don't infect all your co-workers. Stay away from family and friends as much as you can so you don't get them infected as well. There are treatments for the flu if a person is identified early on in their illness. So there are treatments, antivirals, pills that a person can be prescribed that are highly effective against the flu. They're not perfect, as many medicines aren't, but they can decrease the length of time that you're sick, they can decrease the severity of the illness, and therefore they can decrease the likelihood that you'll transfer flu to somebody else because you'll be infectious, contagious for a shorter period of time. The best things you can do other than the medicine is to make sure that you drink an adequate amount of fluids. Dehydration, not drinking enough, can be a very serious complication of the flu, and especially for older patients or patients that have more severe underlying illness, that can be a very serious problem if they get dehydrated. So as much as you can, try to drink adequate amount of fluids. Eating, if you can tolerate it, is great too, but not as important as making sure you maintain adequate hydration, adequate fluid intake. There are other things you can do as well to try to help you combat the flu. There are some over-the-counter medications that can treat some of the symptoms of the flu. Some of them aren't very effective, some of them are more effective. And you can make sure you get an adequate amount of rest. If a person is exhausted, if a person is overtired, so then their immune system may not function as well. So getting lots of fluids, getting lots of rest, eating and drinking what you possibly can are important measures to get you through the flu. And thank God most patients do get through the flu very well. And next time we'll talk about the high-risk patients who are unfortunately at greater risk of complications from the flu. To see this and any of the other videos in our series on the flu, go to our website, southnassaw.org/flu, or just visit the South Nassau Community's Hospital website for both this and some other excellent public health service announcements and medical information. You can also see our full list of physicians to make an appointment with a physician if you need to see somebody for the flu or other medical problems.